Hi guys, thank you so much for joining us today. I am live with Ellen Martens. Ellen, thank you so much for joining me.
You're welcome. Nice to be here. Good morning.
So Ellen is one of our lecturers for the Vet Rehab Summit, which is very exciting. So Ellen, can you introduce yourself to us a little bit and tell us what you're going to be speaking about at the summit?
Okay, so I'm Ellen Martens. I'm a PT from Belgium. I'm doing canine rehab since 2003, so already a long time. I first did my certification in the Netherlands, and later on I went through the CRI, Canine Rehabilitation Institute program in the United States. I also have my certification in osteopathy and manual therapy. So I founded Het Waterhof, that's a rehabilitation center in Belgium in 2009. So we work there with 5 therapists, 2 technicians, and we see all kind of patients, a lot of orthopedic patients, neurologic patients, but also a lot of sporting dogs, really high-end sporting dogs. So, well, yes, that's it.
Fantastic. So hi everyone. I see there are a few viewers live with us. Please let me know if you can hear me. If you can hear Ellen clearly, give us a thumbs up and let us know where in the world you're watching from. We are ramping up to the Vet Rehab Summit. Today is the 14th of October, which means the summit is in 1 month from now, the 14th of November. So very exciting. Today is also the last day of the early bird ticket sales. So if you guys want to grab an early bird ticket, today is the last day. So definitely head over to the website and grab that ticket if that's what you want to do. Otherwise, here's a little secret: sign up as a member and you can have free access to the summit. So what we are going to be doing today is we're going to have a little competition. Last week we ran a competition and I'm very happy to announce that our winner is Sue Wynn. Congratulations, Sue. You have won 1 month's membership to Online Pet Health. And that does, in fact, include a ticket to the Vet Rehab Summit, seeing as that is 1 month from now. So congratulations, Sue. If you would like to win a ticket to the summit, that would be included in a 1 month membership. Be sure to comment in the comments. Let us know where you're from and what is the name of our annual summit. I've already blown it because I've told you guys already. So what is the name of our summit? Pop that in the comments, and I want you to include a colleague who you want to see at the summit. So let us know who you want to see there by tagging them in the comments, and you could stand a chance to win that ticket. So great. So Ellen, let's jump into compensation. So this is your topic for the summit, chatting about compensation patterns.
Yes.
So what can we expect from you?
Well, we're going to talk about all kind of compensation patterns that we see on land and in the water. So this can be compensations during posture, during gait, during transitions, so function. So we're going to talk about what is a compensation pattern, what's the cause of a compensation pattern, what can we do about it, and is hydrotherapy beneficial for this kind of compensation or not? So that's the biggest goal of the lecture.
I love that. So let's chat a little bit about a few of these points. Like, what is a compensation pattern? So at the basic level, what is a compensation pattern?
Yeah, so if you look in the literature, there are a lot of definitions for compensation patterns, but actually what it is a skill that the body deploys when it senses an injury or an instability of the body. So actually, the compensation is a part of an effort by the body to help this misaligned movement become less of a short-term risk to the body. So actually, it's an alternate neuromuscular strategy of the body. So it's just a compensation because of a restriction or because of pain or because of weakness to still keep functioning without having, well, any more risk of injury or damage.
So basically, compensation is not a bad thing. It's the body's way of continuing on when something is wrong.
It's not always a bad thing, but sometimes we see, for example, that we have learned compensation strategies. And if we see that, for example, in the high-end sporting working dogs, and they try to do this high-end agility, for example, with compensation of the body, then they have more risk of injury because they are not loading their body in the right, correct way in functioning. So it depends on what the compensation is or what the cause is and when they do it.
Exactly. So compensation can be a good thing, or it can be a risk factor.
A risk for injury. Yes, that's true.
And definitely, I mean, if the body is changing over time, and that becomes, a permanent or a long-term change, then that's an injury risk. I like that. Okay, so how subtle can these changes be? How subtle can these compensations be?
They can be really subtle. Think about the sporting working dog that has really a lot of drive and still wants to function and do his job, and he won't show his physical impairments, and he tries to do the job and avoid pain or try to compensate for restricted range of motion, and it can be really subtle that we don't see it, and that we don't only see it when, for example, that we do slow motion video and we see this really subtle compensations that they do in the body, or even in the family dog, we see that they try to hide physical impairments. And this, again, like I said before, this can be in posture, this can be in gait, this can be in transitions. So it's really important to have a good, clear view of what is normal functioning for your dog to become familiar when there is a compensation pattern going on. So I think about a patient that I already described in one of the lectures that I did, one of the webinars that I did, is Jeannie had a lumbosacral issue, and the only this main complaint from the owner was that he didn't want to jump or go over cavalites anymore, but that was the only complaint that she had. And the only clinical sign that we could see in this dog, that's when this dog was circling on the right and going from a walk to a trot, it skipped one step. And that was the only thing that we could see. So this could be really subtle. So we have to try to do different things to make the compensation obvious, or let the dog let us see the compensation.
I think that's so important, especially in the competing dogs, in the competitive or sporting dogs, that they are so good at hiding what's happening. And like you say, the drive is so high that we have to get very creative in the tests that we ask them to perform, so that we can see where any abnormal movement is. And I think using slow motion video for that can be really helpful. To slow them down and break it down a little bit, so that movement is clear. So I just want to say hi to everyone who's joined us online. I am live with Ellen Martens, and we're chatting about compensation patterns. And we're also chatting a little bit about what you can expect at our annual summit this year. If you would love to win a ticket to that, let me know what the name of our summit is in the comments. Today is also the last day that you can buy an early bird ticket. So 24 hours to go, guys, and then the early bird tickets are closed. Okay, so now that is out of the way, welcome to everyone again. Ellen, I want to chat a little bit about what happens when we take dogs that have compensation patterns on land and we put them in the water. What is going to happen when we do that?
Well, it depends on the compensation. So what is the compensation, and also depends on what the cause of the compensation is. So let's say we have a dog that is compensating because it is in pain, or because it has restricted range of motion, or because it has too high muscle tone. So if we put these dogs in the water, then they will try to function in the water with their compensation. So they will still compensate in the water because they will still have pain, they will still have restricted range of motion, they will still have hypertonic muscles. So in these patients, it's really important that we address that first before we put them in the water. So let's say other dogs that we have, for example, weakness, hypermobility, or neurodogs, for example, these they compensate also, and these compensation patterns can be beneficial in the water, or the water can be beneficial, or hydrotherapy can be beneficial for these compensations, because we can use the water for extra support, and also we as a therapist can have or extra manual context to guide the movements and to support movements. So in these patients, hydrotherapy can be beneficial. So it depends on the compensation and the cause of the compensation.
Okay, so I love that. So sometimes it's going to help you, and sometimes it's going to hinder and just kind of strengthen those compensation patterns, and worsen the effects of them. So is there a kind of, you mentioned a few points there, like the hypotonicity. Are there guides for us to more easily know, okay, if I put this patient in the water, it's going to be worse, or maybe if I put it in the underwater treadmill, this is going to be worsened versus in the pool, or do we need to just look at each patient individually, what is going on with them, and then perhaps put them in the water and see how they respond, and then decide, is it beneficial or is it not beneficial?
Yeah, so how we when a patient comes in for the first time, what we do is we do an intake, we do a full physical therapy evaluation, then we get our clinical findings, we create a problem list, we write an assessment, and we design a treatment plan. So in our observation inspection, we can look at the gait's posture functioning, and then we can see some compensation patterns. But this is something that we have to add to all our other clinical findings when we do our physical therapy evaluation. So if we do this in evaluation, then we can do our palpation, then we could find the hypertonic muscles, we can do our passive range of motion, then we can find our restricted mobility, we can do strength tests to find weakness, all these kind of things. And then we have an idea of our objective findings, where the compensation is coming from. And then we also can have an idea if we have to address the pain and the hypertonic muscles first before putting them in the water. So, and then if we have addressed the hypertonic muscles, the pain, the restricted range of motion, then we can decide, well, depending on the breed, depending on the pathology, if we would use an underwater treadmill or swimming, depending on our goal also for hydrotherapy, what is the goal that we want to achieve. And then we have to see how the dog functions in the water, if he still compensates in the water or not, because sometimes the compensation lasted already a long time and it's an adapted, learned movement, so that we have to re-guide the body to go to a normal movement. So this is where the therapist comes in the water and try to guide the movement with a manual context. And then we have to see how the dog reacts in the water, in the underwater treadmill, and also after the treatment. So it's really individual, and we re-evaluate every time again.
Okay. For more subtle compensations, do you think that it can be easier to retrain that movement in the swimming pool rather than the underwater treadmill, because you're working with a different movement pattern to walking? So what I'm getting at is, when we're working on the treadmill, we're using movement patterns that are similar to what we have on land, but we're adding the elements of water. When we put them in the pool, we're changing their gait and their movement. So does that make it easier to kind of retrain and break some of those movement patterns before we then go to more land-based work, and then so before we go, for example, to the underwater treadmill and then back onto land? Or do you think it's easier to retrain those movement patterns in the gaits where they're occurring, in the movement patterns where they're occurring?
Yeah, so it's possible to first do the pool work and then move forward to the underwater treadmill and then go to land-based exercises or gating exercises. So again, depending on what the cause is. So if we have, for example, a dog that had restricted range of motion for a longer time and compensates because of that, and if we restore the restricted range of motion, that doesn't mean that the dog naturally does less compensation and more, for example, hip movements on land. So then what we can do is to break up that strategy by, for example, first do pull work, try to stimulate the dog into a straight backward hind limb movement with hip extension. When the dog can do that freely, then we try to do that same hip movement, but then on the water treadmill, maybe with a little bit slope, trying to go from high water with a lot of support to lower water. And then if we have a normal gating pattern on the water treadmill, then go to more functional land exercises, walking, gating exercises.
I love that.
Yeah.
I like the idea of setting them up for success in that way by making it easy and then building on what we get. Guys, thank you so much for your comments. I'm loving these entries. I want to say that if you guys have any questions for Ellen, now is the time to ask them. So do you have a case that you're struggling with a compensation pattern? Maybe you've dealt with the primary problem, but you're continuing to have changes in posture or in gait. Now's the moment to ask Ellen. Pop those questions in here and she can address them for you. Okay, let's see what else, Ellen, we can chat about here. So when would hydrotherapy be like a big no? So for me, in my mind, I'm thinking if we have an amputee and we put them on the underwater treadmill, that's just going to make it really hard for them to use their coping strategy, their compensation patterns that they need in that kind of environment. So what would you say if you're seeing this kind of movement or change, you're not going to go into the water?
Yeah, so again, it depends on the breed and it depends on the pathology. So if we have, for example, an injury and the dog is compensating because of that, then we first want to address the injury and then we want to retrain them in normal functioning. So again, we have some breeds that are not good swimmers. So then we know, even if they don't have an injury or they don't have a pathology, that it's really hard to have a good quality of movement in the pool, then we will try other things. Of course, think about let's say Dobermans, all kind of bulldogs. Those dogs, we try to use other things or try to use other therapeutic exercises to help them with these compensations. Regarding pathologies, we see a lot of dogs that have not just one pathology, but several things. For example, they have a total hip prosthesis, but they also have a nerve injury and they also have spondylosis of the spine. Then we have to consider, of course, all the pathologies and see what is the goal of hydrotherapy for this patient and would it be beneficial for this patient or not? Because I think there are a lot of things that we can do outside the pool in a safe way, because we still have to, for example, these patients, let's say a 4-week total hip patient, we still have to consider the safety of our treatment that we do. The dogs still have to go in the pool, out the pool, has wet paws, can slip. So maybe for these patients, it's safer to do first really controlled, low intensity land exercises before we put them in the pool and try to help with these compensation patterns first on land before we put them in the pool. So.
Okay, fantastic. Guys, thank you for your entries. If you have any questions, now's your moment. Ellen, I'm really loving this conversation. I think that we're always aware of primary problems leading to secondary problems, and you've mentioned that now while you were talking, that often there's more than one pathology, and I know in horses this is something that comes up because it's very it's a little bit like bigger, amplified, right? When there's a small injury and the horse continues in work, and then because of the compensation patterns, we end up with things like ruptured tendons, and that is a very small primary problem leading to a massive secondary problem. So how often are we seeing in dogs that these kind of small primary issues, or they're not necessarily small, but they're not obvious, they're not easy to see, that lead to changes in posture and in movement, are then causing bigger issues down the line as the dog. So I'm thinking of things like shoulder pathologies. Are
Yes.
those primary, or are they actually secondary as a result of chronic compensation and changes in movement patterns?
Yes, of course, it can be both, because that was the compensation that I was thinking about. It can be both. It can be overuse and repetitive strain injuries, and these really high-end, really high-driven sporting dogs that do a lot of load on the medial shoulder, repetitive load on the medial shoulder. But it can also be that this dog has a really subtle hind limb problem that we don't notice directly, and that the dog is compensating on the diagonal front limb and putting more weight on the diagonal front limb, and for that, for example, getting an overload of the shoulder or the muscles around the shoulder. And if this takes a long time or goes over a longer time, then it could be that we have secondary issues in the front limb, and that the owner comes with complaint of front limb issues, but that the primary cause is in the hind limb.
And then it's quite easy to miss that primary cause, because it's been there for so long. It's not an acute injury, and it might be a little bit harder to find. And yeah, I think additional tools for us, like maybe stance analysis, will help highlight those asymmetries, because you'll see that shift in weight bearing, where you might not be able to feel it as clearly in your palpation. I like that.
Yes, and it's easy. It's even more difficult if they have bilateral hind limb problems and they're shifting their weight to both front limbs. So that's even less obvious to see.
Yeah, and those are the cases then where you don't progress as well as you should, because they're just you end up missing the primary cause that's causing the compensation, that caused the what you now see as the primary condition, and then as you're treating that. But as you're treating that, we are always reassessing, so we should then be able to over time see the other things that are happening more clearly. I want to say thank you. This has been a fantastic conversation. We have some lovely entries here: Emma Rose, Sue Knowles, Claire Treese, and Rudu Asvit. I see you guys. I want to give you all a chance, if you're watching this as a recording and you couldn't join us live today, let me know what is the name of our annual summit that is on the 14th of November. Put the name in there for me in the comments, and also tag a friend who you want to see at the summit this year. And then we will announce the winner shortly. And you will win a ticket to the Vet Rehab Summit, which will be part of a 1-month online pet health membership. And you'll be able to watch Ellen Martens, a whole host of other recordings. You'll be able to join our live discussion rooms. It's going to be fantastic. So we'll see you all on the 14th of November, and we'll let you guys know who wins. Thank you so much for joining me, Ellen.
You're welcome. Have a nice day.
Bye.
Bye.